Hello, my name is Patrick DeMeo. I am a nursing program manager for the Department of Cancer Supportive Services here at the James. Today, we're going to talk about penile rehabilitation after a robotic prostatectomy. Why do we do penile rehabilitation after a penile prostatectomy? Well, what it does is helps preserve erectile function and prevent penile shrinkage. So when we talk about the theory as if you don't use it, you'll lose it, that is true. Using it from our perspective is not sexual intercourse or nothing, but it's the ability to achieve and maintain erections. So our protocol, which we will go over, the purpose of it is to help try to restore preoperative erectile functioning. Our protocol does exist of daily usage of either sildenafil or tadalafil, which you'll be taking every evening before bedtime, and also the daily usage of a vacuum erection device, or we call it a vacuum pump. Optional components are penile injections and a Restorex, which we'll get more details. What are you going to expect at your first visit with us? We'll be asking questions upon where you were before surgery, other health factors, and surgery itself. We'll also go over our protocol in depthly in terms of reviewing with you about the oral medications, the vacuum pump, and the options in terms of injections and the Restorex. So when we talk about oral medications, we will be using mostly sildenafil and sometimes tadalafil. You'll be taking those every evening right before bedtime, and you will be starting the day after surgery. Why will you be taking it at bedtime? Purposefully. The way that we're created as man, whenever we're in a deep sleep, our bodies naturally create 3 to 5 erections a night. That's nature's way of just keeping things working. So even though that won't be happening for a while, as the medication's in your system during that time frame, it helps the healing process. This is something that you'll be doing for a year. So even though you may not see results right away, there are benefits of continuing it during that time frame. Some side effects with these medications are headaches, sinus congestion, upset stomach, and facial flushing. Some men have these symptoms, some men do not, some people cannot tolerate that. So we'll get in more depthly, but if you cannot tolerate it, please let us know. If you are taking any nitroglycerin or nitrates for your heart, you are not to take these medications. Now we'll be talking to you about the vacuum erection device or the vacuum pump. The purpose of us using this on a daily basis is to keep the penile tissue healthy and prevent shrinkage. This is something that we'll be doing for over a period of a year. You also can be using this for sexual activity. With the sexual activity component, there are rings that you will be using that you will attach to the vacuum pump that you'll slide off in terms of being able to use. There's also a psychological advantage of using the vacuum pump. When you can see something happening physically inside the cylinder, that helps us as men, both physically and psychologically, as we move through our program. Next, we'll be talking to you about the different options we have part of our protocol. First, we'll be talking about the injection therapy. With injection therapy, we use a combination of 3 different medications, and that is called Trimix. You only can get this medication from a compounded pharmacy, and we have a pharmacy that we use for all of our patients. You'll need to keep the vial of medication in the freezer. While in the freezer, just keep it into a little baggie. When you're ready to use it, take it out. It takes 5-10 minutes, it thaws out. Draw up what you need, put it back into the freezer. As long as you keep it in the freezer, it can be good for up to a period of 5 months. So it has an expiration date. Whenever you need a new vial, all you have to do is either contact the pharmacy, for you have renewals for a year. Each vial of medication is $85, and there's a small fee in terms of the needles. If you live outside of Columbus, there's a shipping fee which they can do no matter where you live. This is a 2-appointment process. Each appointment is roughly an hour each. At your first appointment, I go over a lot of information with you, explaining to you what we're doing and why. What we've learned is if you understand that process, that makes it easier for you as you go through our protocol. At the end of that appointment, I will inject you just as a baseline to see what response you get. At your second appointment, you come back. I show you how to draw the medication up. You draw it up, you inject yourself. We do that so that we understand that you're doing it properly and safely. We then send the medication to the pharmacy. You are to contact them the next day and you can make arrangements with them. Our protocol consists of you're going to be doing this at least twice a week. Even if it's not for any type of sexual activity, it also helps keep the penile tissue healthy and prevent shrinkage. It does not matter which days of the week that you do the injections. but we want you to use those at least twice a week. On the days that you're not doing injections, we still want you to take the oral medications and use the vacuum pump. With the Restorex, you can use that on days you're doing the injections, but not both at the same time. If you still have an erection that's firm enough to penetrate after 2 hours, we want you to take 4 30-milligram tablets of Sudafed. Usually about an hour or so afterwards, you can see the erection go down. If you still have an erection that's firm enough to penetrate at 4 hours, you need to go to your nearest emergency room. The other option that we have for you is called Restorex. This is a penile traction device and lengthening device to help prevent shrinkage, and also it can increase sexual satisfaction after surgery. The protocol for this is you would start 1 month after surgery. You need to do 2 30-minute sessions per day for a total of 6 months. After you reach satisfaction from this, we still want you to do at least 1 30-minute session a day, 1 to 2 times per week. Lastly, compliance is a very important part of our program. We work together as a team, and together as a team, we can help you reach your goals in terms of penile rehabilitation after robotic prostatectomy.